Hey guys, Dr. Beto here, physical therapist, and today I want to talk about your urine. Now, this might be a subject that people are not discussing, but I think that it's really good to understand different color that our urine can become from things that we're ingesting or from things that are happening in our body. So I want to take some time tonight to talk about our urine. Now, most people don't realize that your urine can actually take on a lot of different colors from the full spectrum. Not every single color of the rainbow, but the vast majority of them. Some of them are very rare, but some of them are a lot more common. And so I want you guys to kind of have an understanding of the different color wheel of what's going on in your body when there's different colors that are happening within your urine, and taking note of that. I'm also going to talk a little bit about the different odors that can kind of come from your urine and what those kind of indicate. And when you guys should really be going and consulting with your physician, especially if you guys have any questions. You guys should be consulting with your physician, but especially if you guys are noticing any of these colors I'm going to show you in a little bit, you guys should definitely be consulting with your physician and going down and getting checked out. And some of them, a lot more sooner than others. So let's start with the first one. Let's start with red. So, if you guys are noticing red, not a whole lot of red droplets. Make a nice red color. So there's a few different things that can cause this to be the color of your urine. Some common things that are going to be more benign, that aren't going to be that serious, are beets. It's not going to always look like this type of red, but some beets or even heavy consumption of blackberries can cause your urine to turn more of a red, more of a darker color. But more of the serious things that can cause your urine to turn more red is if there's any blood that's getting into the urine. This can cause, from infections. It can come from prostate problems with older individuals. Usually when there's going to be more blood in the urine, it's probably going to be painful urination. But sometimes with prostate problems in older men, there's not going to be painful urination. But you guys should notice this because you guys are not going to be consuming heavy consumption of blackberries or consuming beets, and your urine is going to look like this. And that's when you guys should go and you guys should really get checked out, and they're going to do a urine analysis on it and kind of figure out what's going on and go from there. The next one is going to be more of an orange. Obviously a little bit similar to red, but it's going to take on more of an orange hue. A little bit more of an orange hue. It might look like the same, but a little bit more of an orange hue. Now an orange hue is going to be more from liver failure. That can come from cirrhosis, it can come from hepatitis, it can come from different types of liver failure. It's going to take on more of that orange hue. It's going to come from more of a bilirubin factor that's causing it to turn more orange. The only thing that really could cause your urine to turn orange that I'm thinking of right now would be some herbal supplements. Senna could turn that. It's more of a laxative. It can turn your urine more of an orange hue. But if you guys are taking a laxative that has senna in it, or you guys are taking an herbal supplement, that should be known to you, or that's going to be a good factor to be able to weigh in, so you guys aren't freaking out. But if you guys are not taking those herbal supplements or senna, and you guys are having more of an orange hue to your urine, you guys should definitely go get checked out. Go consult your physician immediately because something's going on. Most likely than not, it's going to be something going on with your liver. Now, the normal color that your urine should take on is going to be more of a yellow. Not a strong yellow, not too light of a yellow. It's not going to be transparent. It's not going to look like this. That's typically going to be too much water consumption, but it's going to be a nice yellow, a nice light yellow is going to be what urine should really look like. More of an apple juice, maybe a little bit lighter than an apple juice, and that's going to be normal urine, normal consistency. It should look more like something like this. Now, in extreme cases of infection or hypercalcemia or different buildup, your urine can turn some pretty extreme colors. It can turn blue with hypercalcemia buildup. With different types of infections, it can turn green. With bacterial infections, especially, it can start taking on more of a green hue. Sometimes in the hospital, we'll see more of a blue or purple if someone is having a catheter and there's an infection going on with the catheter, and we're gonna have to pull it out. And we're gonna have to the nursing and the physicians are gonna have to take it out and get them on some different medication to be able to clear that up. But that's gonna take on some variation of blue, green, or yellow. Sorry, blue, green, or purple. And it's going to be more of this consistency, where it's going to be definitely a funky color, and you guys definitely want to get that checked out. So, those are the different colors that your urine can take on. Some different things to note is going to be the smell of your urine. Your urine can smell varying degrees of different things. I know if you guys are consuming asparagus, that's going to be a normal smell. Asparagus is very healthy. I like to eat asparagus. That's obviously going to change the odor of your urine. Some other things to really take note of is it has more of a musty smell. That's going to definitely be more indicative of different types of liver failure. You guys are going to get that checked out. If it's going to have more of a sweet aroma, especially we're not tasting it, but if it kind of has that sweet odor, obviously that's an increased level of sugar that's in your urine. Obviously more common with diabetic patients, with individuals that are having more increased sugar or their body's not able to process sugar. And more likely than not, if you're just noticing that it's really off, more likely than not it's going to be a urinary tract infection. It's going to be more of a UTI. It can be other infections, but if it's just really off, most likely it's going to be a UTI infection. And you guys should go to your physician. You guys should go to an urgent care, the emergency room. You guys should get that checked out. If you guys are experiencing any of those extremes of colors, or if you guys are experiencing any of those different odors. So I hope that helps, and I hope that you guys can understand your urine better and know when it's okay and when you guys should really be going to your physician and getting checked out more. Let me know if you guys have any questions or any comments below. I'd be more than happy to try to assist you in any way, and hope you guys have a good day.